Hello, everybody, and welcome to the Upstate Strength Cast presented by the Upstate Coalition. Today, I'm joined by one of my co-hosts here, Logan Krieger, as well as Jess and Cody Gingerich from Onward Physical Therapy. What's up, guys?
Hi.
How's it going? Thanks for having us.
Yeah.
Of course, yeah. Thanks for having us. It's a beautiful facility you guys have here.
Absolutely amazing.
Yeah.
I always just, how clean. Like, I'm just so jealous. You guys just
Yeah.
look so awesome. Yeah.
I remember coming to y'all's grand opening a few months ago, and I'm like, this is beautiful, man. You ain't got a garage door.
I love
Something
the
like that.
glass bay doors. Like, obviously it came with the building. I would love our bay doors. Like,
It actually was on back order for a while.
Really?
So we had a big old piece of plywood.
Just
It
the
looked
first month
really
was
sketchy.
a little dungeony.
Right.
It opens it up nicely though. A lot of natural lights.
I know, I look so mad. I mean, that's what I love is just that natural light coming in.
Yep.
And being able to keep that down and still get that nice.
Apparently, glass is in a shortage because
Everything's shortage right
I had to wait a month and a half to get my shower door glass installed in my house.
gosh.
Yeah, so I just no shower.
Yeah.
Just kidding, but no. But yeah, no, awesome place. Basically, guys, on the Upstate Strength Cast, our goal is kind of get your story, how y'all started out. Obviously, we'd like to know how you met, and what you intend to do with your business here. So. However, y'all, we'll kind of figure out some questions and go from there.
Tackle how we met.
All right, start there.
So Cody is from Ohio, and he went to Ohio State, and I'm from Virginia, and I went to Roanoke College. And so we met at Lynchburg College in grad school, and he was a cohort behind me. But we got paired together for almost like a mentor-mentee type class. And
Snag the teacher, basically.
Yeah,
Nice.
nice.
Yeah.
Nice.
Nice.
I like it.
And so we ended up spending a lot of time together just through that, and then started, I guess, developing feelings and a little crush. And, then I found out that I was 3.5 years older than him, and we were both like, "Uh-oh, what do we do?"
It's just age.
Yes, age is just a number, right?
Yeah.
And then here we are. So,
Yeah. So then, as far as getting this started, it was going through PT school and what I thought of PT, and then what I was learning and found out PT was didn't really jive. And so as I was a student, I was like, I don't think this is what I'm going to be doing like long term. So worked for a year or two, but always with this idea of like wanting to do my own thing, kind of get out of what insurance does and dictates and all of that thing, basically avoiding the healthcare system. Not a great spot to be.
Right.
Yeah.
So was given this opportunity with Onward. Onward is a growing brand, Onward Physical Therapy, and then we're here, Onward Greenville. So basically then just took that and ran with it. We found Greenville. We moved here about a year ago, and really what we're about is the fitness community, which is huge here, right?
Yeah.
Like it doesn't matter if it's CrossFit, a fitness studio, barbell studio, like whatever, powerlifting, all that stuff. It's everywhere here.
Yeah.
And that's who we want to serve, right? It's like people who care about their health, want to continue doing their activities. So got plugged in here, and it's been great.
Awesome.
I feel like that's been a huge kind of underswell, and I'm not a physical therapist, but in the physical therapy community has been like there's this divide between like hospital, like post, like just rehab in a classical sense, and then there's now this like, hey, if there's aches and pains in your fitness life, we can help you. We can make that better. Like me as a coach, when someone comes to me with like, oh, this hurts right here, I'm like, maybe just don't use it for a little while and see if it gets better, And it's like, and then getting hooked up with physical therapists, like, no, hey, strengthen this thing, do this thing. The mindset has become, do what makes you stronger, and if you're stronger, then the pain will go away. Or you'll move better. In essence, just get stronger, right?
Yeah.
Is that what you're kind of talking about? Like you said, you didn't jive with the healthcare system.
For sure. So and you're right about this divide among physical therapists, and we actually work for another company called Institute of Clinical Excellence, where we travel around the country and teach other PTs and help kind of push this like what we call fitness forward mindset, where like fitness is the main thing that we're trying to achieve, right? Because that is going to then battle against all of these healthcare disease or like lifestyle diseases, right? And so
that feed into pain. That
Exactly.
feed into
Yeah.
things that keep you out of being active, whether it's hiking with your grandkids,
Yeah.
or taking a bike ride down the Swamp Rabbit Trail. Like that stuff plays into that. And there's a lot of like new research, like 2020, 2021 research that's like, if you are stronger, like you're going to be less likely to be in that metabolic syndrome, which is diabetes, blood pressure, all of that stuff. So that's the space that we want to dive into. And then with the going on to that Institute of Clinical Excellence, he's in the extremity division and the spine division, and I'm in the pregnancy and postpartum division.
Oh, very cool. Yeah.
And so that's what's really awesome about that, is that we can try to get everyone. And so like from my perspective, I get a lot of women in that are like, well, I'm pregnant and I've been told not to lift more than 20 pounds. Why?
Yeah, why?
Exactly.
Why? Yeah.
So I've been asking that question to people and to healthcare providers. Why are we telling women this?
Yeah.
And the answer is we don't know.
Yeah.
Yeah.
And I'm
Interesting.
like, well, here's 500 articles supporting why they should be doing this.
The research has been there too. I remember being in undergrad like 5 years ago talking about it, and it's just still so pervasive. I think it just,
It's fear.
Right.
It's fear.
It's true.
And what is sad about that is when it's fear from a healthcare provider that carries over to that patient, and that makes it worse. And then like if you're pregnant and you have a 2-year-old running around that weighs, 30 pounds, but does this while you pick them up, right? And that can so we should be training these women from a strength perspective, because it is safe. It's very safe. So
it seems to be more like a proactive approach than like a reactive approach to physical therapy. So instead of waiting until something happens wrong to fix it, you got you're going in and saying, hey, this can be improved before, so that it never happens in the first place.
Yeah.
So
And then
that's
how
really
can
awesome.
we modify things like in this short time that there is injury
Right.
that keeps you doing what you love? There's a little frustration to it when you can't go like balls to the wall.
Yeah.
Right?
Oh, yeah.
But at the same time, like you're still there, and then you're loading that tissue, so that tissue's still getting stronger as it's healing. That's going to then get you back to the gym quicker than taking 2 to 4 weeks off, and then you get back to the gym feeling better, and then all of a sudden it blows again, and you're like, oh.
Yeah, makes sense.
Yeah, like what you're saying with like, if I've got pain here, right? Well, maybe benching is a problem, but what are other things we can do, right? Can we get a landmine press going? Can we just incline it? Can we, all these different just modifications where it's not just like, all right, well, we got to take 6 weeks. Let me not go to the gym. Let me not see my friends, right? Like all of these other things. Like when people don't go to the gym, it's not just they're not getting stronger. It's also like, that mental health is huge, right? That's their community.
Absolutely.
Like all of that.
And
so
I love hearing that. Like I remember not even 10 years ago, it was, you got you're in the gym and you're squatting. Ooh, something hurts, right? Let me go to the doc. You go to the doctor, they say, stop squatting. You're like, very badly, insert expletive deleted here. No, I'm not going to stop squatting. What do you mean? Like, this is what I loved. Like, and then I found physical therapists are like, well, let's keep you squatting. Maybe we're not going to do the barbell back squat for a minute, but here's the archetypes that we can do to make sure that you continue to progress. And it's like, keep moving. And all the literature supports that. I mean, that's huge.
And the cool thing too is like we don't need a doctor's referral.
Oh, that's very cool. Yeah, very, very cool.
If there's that ache or pain, instead of going and spending $1,000 on an MRI where they find a meniscal tear that may have been there for 15 years,
exactly.
that's probably not the source of your pain.
Yeah.
But then again, you hear that, they diagnose you with that, and then there's that fear again.
Yeah.
Fear is powerful, and that's where we are trying to keep the fear out of their minds, because the body's resilient.
Yeah.
It's really resilient. So
Very much is. Yeah. But
so then how do, like you say, you don't need a doctor's referral, how do people get in touch with you? And then also, when would, like, Onward Physical Therapy, I think people think physical therapy, like, that's in medical, right? Like, when should they see when should somebody see a physical therapist?
Yeah, so I mean, we have a couple different ways. One, to get in touch with us. A lot of the communicating we have done and continue to intend to do is on our social medias.
Yeah.
So Instagram, people will just message us on there. They'll be like, hey, someone said, you guys can help me with this. Is that something you do? And we'll say, yeah, let's, when are you available? Let's get you on the schedule. And on our Instagram, in the link that we have in our bio, is like goes to our website, and there's just an easy button, hit schedule, and pull up our schedule. So
that's awesome.
It's pretty much that simple. As far as like when, usually it becomes, I would say the most common is when someone's been dealing with something that is limiting their capacity at the gym in some way.
I like that.
Right?
Yeah, very nice to put, yeah.
So it is, whether it is, hey, I want to be overhead pressing and my shoulder's been giving me problems and I've been, avoiding it for 3-4 weeks, right? Then they'll come in, or sometimes, hey, I back squat or deadlift, tweaked my back yesterday. Can I come in and see you? Because a lot of times, like that type of stuff where it's like a real quick tweak, the sooner you get in, like that stuff will clear up pretty quickly. It really will. So that's a big thing. And then we also have a program called Restore Perform, where that's more of like a monthly membership and just kind of like maintenance. Like we do all the feel good stuff, right? Like dry needling, cupping, spinal manipulation, any of that stuff, where it's like, if you're working hard enough, you probably have something going on that might not be necessarily limiting you, but
absolutely.
Yeah.
Make it feel better.
Right.
Right. So that's been something good, where people just come in once a month. Hey, today it's my shoulders kind of giving me, a little bit of trouble. And then next month, hey, my knee kind of like, when I was doing something the other day, I felt that a little bit. So let's see what's going on there.
Yeah.
So
Also back to like the doctor's referral too.
Yes.
I know that's, people have their doctors, so like if we need to communicate with them, we are about that.
Right.
This isn't like a bypass a doctor, and because they have their place and they're respected, and so
I think it's more transitioning the focus from thinking, like you guys said, like a referral, like you have to have that, to understanding that you guys are here to help prevent that visit to the doctor from happening, hopefully, if it's physically related. So that's awesome.
To avoid the unnecessary imaging,
Right.
or like the unnecessary opioids.
Yes, very much
big
so.
time.
Yeah, absolutely.
I agree.
That's a big one.
talk about like when like pregnancy, postpartum, when they come see you.
So there's been a big push in like the pelvic space. Like if you are pregnant, go see a PT while you're pregnant, and it's not like a 2 or 3 times a week for your whole pregnancy. It's just for like, hey, this is some stuff that you want to be thinking about during your pregnancy. I go through different ways to push during labor. I talk about the different stages of labor and what they mean, and like what you can do. Like they don't want you to eat during, like when you're in labor, because just in case there's a risk for cesarean, which is surgery.
Oh, sure.
Well, the literature on that was from like the 1940s.
That's crazy
like,
to me.
Now
Jeez.
anesthesia has come a long way,
Yeah.
and if you think about labor, normal labor can be up to 3 days. So if you think about someone laboring and pushing for 3 days without any food, like that's not realistic.
Yeah.
So it's like little things like that. Even like toileting habits, like toileting behaviors and stuff like that to help with that postpartum. But this not all pregnancy postpartum. Like I see women that haven't had babies that have issues with leakage and stuff like that. So I say again, once it's happening, come in, like let's get it figured out. Because again, if you want to have babies in the future, if you're leaking urine now, let's get that figured out.
That's true.
And then as far as postpartum, I usually go through this trying to get people while they're pregnant, just so they know everything, because there's not a lot of information out there. And then when you go to an OB, they do a really great job. Right? They keep mom safe, but they're busy. They don't have time to go through everything. But in terms of postpartum, the traditional was like 4 to 6 weeks. But depending on what birth you had, vaginal or cesarean, and why is that a thing? I was like, you still have to function. Come to me 2 weeks. Like have that time with your baby. Let that tissue start to heal a little bit. It's not going to be 100%, but let's start talking about different things that you can do, and it should be 2 weeks postpartum. So that's
awesome.
what I recommend.
That's really great. I wish, honestly, I feel like that message needs to be spread more, more broadly for sure.
I think I posted it on Instagram for sure. I probably need to do another post on it.
No, that's seriously, that's something that I'm not a lady, so I obviously can't relate, but I feel like, when I think of pregnancy, I don't think of physical therapy typically, right off the bat. Right. So that's really cool.
Those tissues down there stretch up to 200 to 300 times their original.
Wow.
Yeah. And so like if there's things happen.
Yeah,
No, of
sure.
course. Yeah. Right.
It's like if you have shoulder injury or shoulder surgery, right?
Yeah.
Why is you go to PT when you're done with it? So why are we not talking about this after, even after a very uncomplicated vaginal delivery? It's
Right.
still a very traumatic thing, or can be.
Yeah, absolutely.
And not to mention maybe even the mental aspect of it.
Yeah.
And so
And even leading up to that, you know, the actual pregnancy itself, like coming
Yeah.
and seeing someone like you to get that knowledge and education on how to,
Yeah.
you know, I guess.
and like and you know, it's so much more than that too. Like your
Yeah.
identity changes a little bit. Like
Understood.
you go
Yeah.
from maybe a CrossFit athlete that, maybe whatever you identify as, to now you're a mom.
Mm-hmm.
And sometimes that transition can be really difficult. And
Right.
Absolutely.
I can only imagine.
You shouldn't have to do this alone. And like alone
Right,
by alone,
right,
obviously,
right.
like, whether you have a partner or not, like it's still, there's help out there.
Yeah,
So.
that's awesome. It's really great.
It seems like we choose to kind of have this support crew. Like everybody's got like, oh, I got my massage therapist. I got my barber I go to. I've got the
Yeah.
doctor, right? Like
Yep.
physical therapists, I feel like should be on that list.
Yeah.
And it's one of those things that if you just have in your back pocket, whether pregnancy comes up, injury, pain, you've got that person there to help at least course correct when you're going through these things.
For sure.
Right.
And that's kind of why we're outside. Like a lot of times,
Yeah.
right, traditional PT is like, hey, I'm going to go here,
Right.
3 times a week for 6 weeks and then never think about it again.
Yeah,
Right.
exactly.
We tend to, I would say most commonly, maybe once a week for a week or two, get things calmed down. And then from there it's spaced out, and it's never really like a see you later. It's like, check in a month from now.
Exactly.
How are things going? Check in, 2 months, how are things going? And then, just kind of be in the bubble.
Exactly.
Right.
I mean, yeah, like it's having your team behind you. I think, and you look at any high performing athlete, like they're going to have physical therapists on
Yep.
the list.
Yeah.
And then common man, it's like this is something that is available for you to have
For sure.
and has a huge benefit, and we've seen it from the top down, whether it be stepping on stage on a platform or just lifestyle pregnancy choice, whatever it is. But
Yeah.
that's really cool.
Yeah.
That's really, really cool.
I respect that. Anything else you guys want to tell us as far as like any kind of tidbits of information about yourselves or about Onward that people might want to know about?
I think a lot of what, I guess a couple other things that we do and things that we've done additional training on is like, I also coach CrossFit.
Okay.
So
Very cool.
that also includes like a lot of Olympic lifting and things like that. So like Olympic lifting technique, like I can, take video, break that down, lines, angles, all of this. And like, let's say, on your pull, right? Maybe that bar is coming out and away from you. And a lot of times there's some technique involved there, but if you don't have your shoulder internal rotation adequate enough to where you can get that high pull, that might be the reason it's coming out. Your technique might be solid, but nuances like that where I really enjoy that stuff. Like slowing it down, like because those techniques are like so like you have to have it spot on to lift the maximal weight that you can. And so, the smallest little details matter with that stuff. So I love doing that stuff too. So it's even if you're not injured per se,
Right.
but you're trying to work on your technique and that type of thing, would love to work on that too.
So you actually practice what you instruct and help people rehabilitate
For
from.
sure.
So both of you
Yeah.
guys do
Yeah.
actually. So
Yeah.
that's awesome. You just had a competition this weekend, right?
Sure did.
Yeah. How'd that
That's
go?
awesome.
We didn't finish last.
Okay. Listen, there you go. I like that. That's
We had a blast doing it. It's you go through the suck of it. But afterwards, you suffer together and just makes your bond stronger.
right.
Yeah,
Right.
absolutely.
So we had 100 between my partner and I. We had 195-pound thrusters.
Oh
Wow.
my God.
With every minute on the minute was 5 burpees over the bar.
Yuck.
So
Yuck.
just taxed to the fullest. She was trying to get 4 to 6 in. I was trying to get 2 to 3. But we finished, so it was good.
That's awesome.
I'm winded just hearing you say that.
Yeah, I know, yeah.
That's,
It was
Yeah. I truly think that that's one of our most important things is we're not going to have anybody come in here and ask them to do something that we're not
Right.
Right.
actively doing in our day-to-day life, right? That is leading from the front is of our utmost importance. Like, we're going to be at the gym. We're going to be like, nutrition matters, sleep matters, stress management matters. All of that stuff plays a role, and you're going to hear us talk about it if you come in here, right? It's not just like, hey, my shoulder hurts, let's look at your shoulder. No, it's like, it is a global thing. Like, you need to have spend some time with your heart rate up. You need to lift some heavy weights. You need to like not eat like a 2-year-old. Right? Like, all of these things play a role in the whole system. And so if we're not doing that stuff, how can we ask you to do that?
Right.
So
exactly.
that's hugely important to us.
That's what I absolutely love, like, marriage of fitness and therapy, and like you're saying, like, technique on the pull, right? I would never know, like, oh, my internal rotation is lacking, so let's look at that and then couple that with strengthening, and then you're getting a complete picture. And that's we've been missing it for decades, and I think it's finally come to the forefront. I'm getting so excited. It's really, really cool. It's really cool.
Yeah, I heard a quote. It said the leading by example isn't a good way to lead. It's the only way to lead for and instruct, especially in you guys' position. So I think that's really great. But do you have any other questions you want to throw out?
No, very cool. Yeah. You guys,
awesome.
So 6 months been here, moved in, and kicking some butt, taking some. I love it.
Absolutely trying to.
That's right.
Over here at Hampton Station, we love being here with all the other businesses. It's been good.
Yeah. So where can people find you guys online?
So on our website is just onwardgreenville.com.
Okay.
Instagram is at onwardgreenville. That would be the main 2 spots, I would say. Facebook is the same, Onward Greenville, but
you guys got lucky. All your hash or your tags are the same thing.
It works.
Very nice.
It absolutely
Cool.
works.
Yeah.
My name on Instagram is Cody Gingerich DPT.
Okay.
That's Gingerich.
Nice.
I think
Very nice.
hers is the same, just Jessica Gingerich DPT.
Awesome.
So, yeah.
And then we have emails too that are
Okay.
just our names, Jessica at onwardgreenville.com and Cody at onwardgreenville.com.
Nice. Very nice.
That's a better way for communication.
Yeah. Well, guys, if you're watching or listening right now, make sure to come and check these guys out. It's an awesome experience, and I like their approach to the holistic and preventative model to physical therapy. But guys, thank you for listening to the Upstate Strengthcast. You can find us on Spotify, Apple Podcasts, Google, pretty much anywhere, YouTube, whatever you want to do. Tune in, listen, appreciate you, and see you next time.